Hello, good evening everyone. Welcome to yet another Facebook live session. So, at Zenith, we primarily cater to couples facing fertility issues, women's reproductive health, preconception health, and well being. Which brings me to today's topic, that is fertility and the factors that influence it. This is a very broad topic, including male and female factors as two different sections. But today we will be primarily focusing on female fertility. As a fertility center, it almost becomes our moral duty and responsibility to firstly educate and then encourage timely screening tests to regulate a healthy reproductive life. There tends to be a lack of knowledge among young women regarding fertility and the factors that influence it, like the lifestyle factors or the risk factors that can cause a decline in infertility, the fertile window, and so on. Without appropriate education, women tend to wait for their body to show some kind of signs or symptoms and then go to the center and get checked up. And that is the reason why the underlying problem or the risk factor gets detected very late. This general lack of knowledge may cause a misinformed decision about starting to plan a family. So let us start from the basics. A woman is actually born with a fixed number of oocytes. At birth, there are approximately 2 million oocytes, and when the woman hits menarche or when she hits puberty, these have already reduced to about 3 lakh oocytes. By the time she's 35 to 37 years old, the oocytes have already dropped down to 25,000. So, approximately, a woman usually has around 400 ovulations. So, basically, what is happening is that in a normal menstrual cycle, that is of 28 days, the first day of your period, that is considered day one of your cycle. So, like I said, there is this fixed bag of oocytes which are actually immature that a woman is already born with. Basically, around 20 to 25 of these immature oocytes get selected, or a cohort is formed of these oocytes, which is very aptly seen on an ultrasound as follicles of about 9 mm. When we see these follicles contain these immature oocytes. In the first half of the cycle, one of these follicles tend to grow, which means that the oocyte inside these follicles are maturing. When it reaches the perfect size, this follicle ruptures and the egg inside this follicle or the oocyte inside this follicle is picked up by the fallopian tube. Now, this process is called ovulation. This concept brings us to the definition of fertile window. So, what is the fertile window? The fertile window is any area or any other number days surrounding this ovulation period. Why? Because the oocyte, which has been released by the follicle into the fallopian tube, is actually waiting for the sperm to go ahead and fertilize it, which will eventually form the embryo. So that is the concept of this fertile window. So in a normal menstrual cycle, which is about 28 days, the fertile window is between day 11 to day 16, somewhere around that time. This, however, is true only in a 28-day cycle. If you are having periods that are for a longer duration or for a shorter duration, the ovulation time also changes accordingly, and so does the fertile window. So like I said, the oocyte has been released, it's in the fallopian tube and it is waiting for the sperm to fertilize it. Once the embryo is formed, the embryo takes about 4 to 5 days from the fallopian tube to reach the uterus, and following that, the uterus becomes responsible to start the sticking process, or also called as implantation, which eventually gives us a pregnancy. Now, actually, this whole process is got a unique synchronization and flow to it, and our body is sending signals to these gametes and these embryos, and it actually may seem almost mystical, but is a very methodical process. So this is what we are talking about in case of in a normal menstrual cycle. So this is why we take this process for granted, don't we? Because as Humans, when we are born, we feel okay, we have the capacity to procreate. But fertility is age dependent. For both men and women, this fertility tends to decline. In case of men, of course, the decline is much later. But like I said, we are talking about the female fertility. So, in women, what happens is that by the time they start hitting the age of 35 or 37, this bag of oocytes that I was telling you about is actually diminishing quite rapidly. And it is not only the quantity, it is also the quality. So, after 35, even if there are a few oocytes, since the quality starts reducing, not necessary that they are having the capability to fertilize in a healthy pattern. Now, 35 is again just a reference age. It does not mean that it cannot happen before. So many times in our OPD, we are actually nowadays we are seeing it much more commonly that women of the age of 31 or 32 walk in with a completely different problem but end up getting diagnosed with low ovarian reserve accidentally because we have evaluated them. Now, why is this happening? What is the reason and how quickly a woman's fertility is declining? What are the factors that can cause this? There are genetic factors, okay, and also most importantly, lifestyle factors. Now, genetic factors is very difficult to control, and also, you can get a better idea about how fast would you hit, the perimenopausal, or how fast will your reserve drop. Can also depend on your mother or your maternal aunts. So getting a brief history about their reproductive life will actually help. Sometimes also conditions like endometriosis, PCOS, these are conditions where the ovarian reserve, the time or the decline in the ovarian reserve can be affected as well. But let's talk about the lifestyle factors because those are very much in our control. So I'm pretty sure most of you, when I say lifestyle, you have a list of things and they're all very common. So let me, just brief them. It's about eating junk food, not exercising, having lack of any movement, alcohol consumption, smoking, excessive caffeine consumption, obesity, stress, lack of sleep, 12-hour shifts where you don't get time to eat your food on time. So yes, all these factors are your lifestyle factors and they do affect fertility. In fact, they affect a lot of things, but like we are talking about fertility, so they affect fertility as well. And all this brings me to the concept of oxidative stress. So basically, what is oxidative stress? Our body actually is through the diet, through our healthy lifestyle, through the fruits that we eat, the vitamins, everything, they have a certain amount of antioxidants in the blood. So our blood has a few antioxidants, and these antioxidants at a cellular level they are maintaining the health of the cells. When this balance is hampered, I mean to say, when the antioxidant defense mechanism is hampered, free radicals are released, and these free radicals go and attack the cells of the body. They attack everywhere, of course. Like I said, they can attack any cell of the body. They can attack the pancreas. That can lead to diabetes and so on. In case of fertility, yes, it goes and attacks the cells of the eggs and the cells. Like I was talking about the signals that are sent out to the body to for the fertilization process. I was talking about the mystical process of fertilization. These free radicals can go and affect that process. It can affect the quality of the oocytes. It can affect the quality of the sperms. It can affect the process of fertilization, and that is when the whole process or the procreation, the whole process of reproduction is getting hampered. And of course, like I said, the lifestyle factors is responsible to create this imbalance and to create this kind of oxidative stress. That brings us back to what should we do. Now I completely agree that young women, right from the obviously the ideal reproductive age nowadays is somewhere between 25 to 35, and women get married early, get married late, second marriage. There are a lot of things and of course in all of this we want to succeed in our careers, we want to impress our boss, we want to hit deadlines. there is so many things happening, and it's all perfect. I mean, it has to be done. That is also a part of life. But in this kind of lifestyle where you're having burgers for lunch, where you're having sleepless nights, you're having 6 to 7 cups of coffee to stay up, and you just are sitting in one place, you're having a sedentary lifestyle, not having any movement because of this kind of lifestyle. And most girls, they end up spending almost 6 7 years of their life living like this, not realizing, because obviously most of the times there are no symptoms really, but they don't know what is happening inside. That is when this oxidative stress, the process of oxidative stress starts because of this lifestyle, and the fertility starts to reduce. So what should you do? Actually, with this kind of lifestyle, many young women already start getting some kind of symptoms. So, what could these symptoms be? It could be irregular menses, it can be scanty menses, they have acne, or they have suddenly they put on weight. Many a times women are who are, and this is true for married and unmarried women, of course. Many married couples, they are experiencing sexual dysfunction, they experience pain during intercourse, or they have other difficulties, and they just live through it for almost 3 to 4 years, not understanding or not even trying to get help. Well, this is actually your body trying to tell you that something is wrong. So these things have to be evaluated. Other than that, like I said, there is endometriosis, there is polycystic ovarian syndrome. These kind of symptoms and issues are actually a sign of your body telling you that something is wrong and you need to get evaluated. Again, for a married couple, when they are married for a year and they are trying to have trying to plan a pregnancy, they've tried properly for a year of unprotected intercourse and still haven't succeeded, then that is a call to get help and to meet a fertility specialist. Now, for women who are about 35 years of age, we do not recommend that you wait for a year to try naturally. We actually recommend that within 6 months of regular intercourse, if you still fail to conceive, you must go and further get evaluated. In fact, when we are seeing the number of cases of low ovarian reserve at our clinic, we almost feel like making it a recommendation to get checked even when you're 31, 32 years. And this is true for even the unmarried women, for the married couples who are just recently married, but who are not sure whether they should plan for a baby, and they just wait it out. Ki, nahi, abhi, it's just I'm just 32. I can wait for the next 2 to 3 years and then plan for a family. So this is true for every woman actually, who's married, who's unmarried, who is unaware of her fertility status. So what should be done? The best thing you can do is actually go and visit your fertility specialist, or any gynecologist, and you can ask your gynecologist to refer you to good fertility center, and you can go and speak to them, because they will actually tell you as to whether you should take action about something or no. So what will happen when you go to your fertility specialist or even your gynecologist? So the basic thing is going to be that they start with by taking a history. History would include your medical history, your if you've had any surgeries, your menstrual history, whether you're having a regular menstrual cycle, sexual history, whether you're sexually active, whether you're married, you're unmarried, whether you're facing any difficulties while having intercourse. Of course, if you're trying for pregnancy, then your infertility history as to how many months or years have you tried, if you've had any previous pregnancies, any abortions, your genetic information, whether you're carrying any genetic condition, or like the menstrual history of your mother, etc. And of course, lifestyle factors, like I told you, what kind of exercise are you doing, what kind of food are you eating, all those. After that, based on your history and based on your age, of course, certain basic lab investigations are going to be helpful. And they would usually include a thyroid profile, prolactin levels, and these are all hormones. Basically, these are all hormones that can give us some indication about our reproductive life. There is, of course, AMH, that is the anti-Mullerian hormone, which is primarily going to tell us about our ovarian reserve. HbA1c levels, that is the average blood sugar levels of the last 3 months. Vitamin D and B12 levels. Now, even if any of these are abnormal, your body may not show it. So it is very important to get these checked. For example, vitamin D. Vitamin D deficiency is probably present in 80 to 85% of Indian women nowadays. In fact, like I said, it's mostly an accidental finding because you go in for something else and you get a few other tests done as well, and that's when you come to know. But it may not seem so important, but actually vitamin D is very, very important for your fertility. In fact, vitamin D deficiency is seen very commonly in polycystic ovarian syndrome as well. And the treatment is very simple. It's just a medicines for a course of 6 weeks, and your levels get back to normal. You just need to monitor them. So basically, all these tests are going to help us analyze. The next important thing, especially if you go to a fertility specialist specifically asking for how long do I prolong to plan a pregnancy, that time the reserve or the ovarian reserve is very important. And other than the test of AMH, like I said, there is another way to diagnose it, and that is through the ovarian assessment. Now, basically, our ovaries have these small follicles, like I told you, and they have to be analyzed or checked on an ultrasound around day 2 or day 3 of your menstrual cycle. That is the most accurate time where we can see the AFC, that is the antral follicle count, which in simple words means your ovarian reserve. After getting yourself thoroughly checked, and after the fertility specialist has evaluated you, there is going to be a counseling session. Obviously, if there is an issue, that can be sorted out. So these are basic things. Having low vitamin levels can be taken care of. Having abnormal thyroid levels can be taken care of with just medication. So let's start with the basics. If the doctor feels that there is something wrong, for example, your previous history, your past history, your menstrual irregularities, your lifestyle changes, all these things will be first addressed. And lifestyle is again one of a very important factor. Regular 8 hours of sleep, having a healthy diet which includes all your proteins, your carbs, your vitamins, minerals, everything. Of course, a dietitian is going to help you more, and you're going to plan your diet, and that is going to be more apt. Then if you are having habits of smoking, slowly managing that and reducing your caffeine intake. Alcohol consumption is not absolutely you don't have to stop it, but based on the consumption you probably can consider reducing it, and so on and so forth. After that, the hormone levels are going to get corrected, and this is all the basics. But if after this evaluation, you as a single woman or as a couple, you realize that your AMH or your ovarian reserve is low, what do we do next? I think for a couple, it becomes quite, you can just think, okay, now is the time to plan for pregnancy and go ahead and plan it. And of course, if there is going to be difficulty in that, but at least we have figured it out and at least we have diagnosed it. But what about women who are unmarried, who are 31, 32, and suddenly they get diagnosed with low ovarian reserve? Well, nowadays, and we are actually encouraging it, and there is a very, very good option for such women, and that is egg freezing or oocyte preservation, that we call it. Basically, the women, whatever eggs that are left are preserved and stored in the embryo lab till the woman can figure out what to do next. So this gives her the option to plan her life but still preserve her fertility. And actually there is a video done by Dr. Mamta as well on egg freezing. It is very informative. The entire process is explained, and you can have a look at that as well. But many women get scared that, how could we do such an invasive or an extensive procedure without even getting married or even having a life? Well, you can choose what you want to do. You can even if you have not don't even know whom you are going to marry for the next 2 years, or don't know what you want to do, or you know uh, everything seems very blurred to you, but still this is very much in your control, where you can control your oocyte, or your fertility. So it is a much encouraged procedure. The next thing, this is actually a very good option even for women that are suffering from cancer, or other diseases that can eventually affect fertility. Well, this was about the invasive fertility preservation. There are some simple things that women can do. So suppose you do visit a fertility specialist and everything is fine, your ovarian reserve is good, your AMH is fine, all the levels seem to be absolutely fine, doesn't mean you take it for granted. You must know that at any point, at any year, this can suddenly start dropping. So the some basic things that you can do to improve that life is by taking a few antioxidants. Of course, your fertility specialist is going to counsel you on that, is going to guide you on that. Having regular checkups, improving your lifestyle, including exercise and meditation and yoga in your life, and of course the other factors, diet and so on and so forth. And of course, regular follow-ups. Even if everything seems normal today, a follow-up is mandatory, because anything can change in the next 1 year. So that was about today's topic about fertility, female fertility in general. This live session was mainly to focus, or to alert the young women who are following their passion and living their life, and basically keeping their reproductive life as a sideline. And it's absolutely fine. Like I said, we have to maintain a balance. When you know that your reproductive life is been taken care of by somebody, you can actually go ahead and live your life the way you want. You can, travel or follow your passion and so on. But what is most, forgotten by these young women is that something is happening there in their body as well. And this was mainly to alert you or to highlight these points. And I would actually encourage every young woman to go visit your fertility specialist just for a general routine checkup, and do the necessary screening tests that are required for a healthy reproductive life. So I think that was about today's session.